It's great to be back here at the Aria Torresdale campus. I was explaining to my students that's here today that so when you're here in October, how does this work? I said it's sort of like it's time to get married. October was our engagement. The definitive agreement was the prenuptial agreement, and this is the wedding. And the great thing about weddings is, the future is limitless, and I think that's true here. There's no turning back, so you might as well have fun. So that's what we're doing today. And the what this is all about is today it becomes official. With the agreement of both Aria and Jefferson's Board of Trustees, we've now completed the transaction between Aria and Jefferson that allows us to move forward as one organization. One organization that's absolutely intent on reimagining the customer experience, the patient experience, and on transforming healthcare delivery for the people of this community. But more important than the what is the why and the how. And the why, I think, is really the key. Not to overdo the wedding analogy, but this was very much of a Match.com. The ability of Aria to basically have their choice of really any suitors, given the great job that's been done here, was really something that we took very seriously. The why for us is, and I want everybody to recognize this, that what has happened at Aria under Kate's leadership with Sandra and Andrew and the rest of the team is phenomenal. It's not just phenomenal as a financial turnaround. It's not just phenomenal as a quality improvement. The fact is that under their leadership, Aria has become a leader in high-quality, low-cost care for community academic center. That's what made us incredibly excited about being Aria's partner. The fact that they didn't need to do anything, and the same thing was very much true with Abington, but the fact that they wanted to do things for the right reason. The other why is because Aria has been able to do this in a really pluralistic model. In a model where private physicians and employed physicians work together, where nurses and doctors work together in interdisciplinary teams. And that's been Jefferson's stock and trade for quite a while now. The how is in some respects even more interesting. And the real heroes of the how are the boards of trustees of both organizations. Let me tell you what's different about this. This is not a consolidation. This is really a shared community governance model. And I just want everybody to understand what's different about this. In most situations, an academic medical center, either for an exchange of a couple board seats or some dollars, and then there becomes an acquisition. This is a merger of great organizations where boards, these incredible volunteers that really lead these institutions, have gotten together and said, it's more important about the community and the patients than it is about us. So I want everybody to understand what is happening here that has never happened before in an academic medical center. As of today, our board has as many Aria board members as Abington board members and Jefferson board members. So if any of you ever think, boy, is this a good thing for Aria, or we're going to have enough say, the fact is, we are all in this together. So when we had the Abington announcement, it was better together. This is now even better together. It's going to be like sequels, we'll have to run out of, this time we're really serious, but we'll probably use a different one there. And the last thing is that one of the amazing things of this for me, both personally and professionally, has been the people we've been able to bring together. And Kate, I think my list really begins with you. I think you guys know what you have in Kate. Kate, I was just talking with some folks from the University of Pennsylvania Health System, and they talked about your tenure at Pennsylvania Hospital. This is an interesting story. We had about 2 years ago, a national radio show did a thing with 4 CEOs that really get it in the Philadelphia area. And this was well before we had talked to anybody. And I'm sitting there with Larry Merlis, right? Remember that, Larry? Kate Kinslow, myself, and this other person's now running shop. But other than her, it was just really amazing because we all talked about very different leadership styles and the whole idea of this. So the fact that we now at Jefferson have that kind of talent is unbelievable. And then an incredible thank you to Bob Truitt, the board chair of Aria, and I'd like to give him a round of applause. Bob, Ed, and the rest of the board love this place. And the fact is that their enthusiasm and recognizing that this is something different, their enthusiasm and recognizing that Aria is not only going to get even better, but is going to be such an important part of the entire New Jefferson, has really been infectious and is really the reason that this has worked so incredibly well. So I'd like to thank all the trustees and all the physicians, management, and staff who have really been supportive of this. So what this is, it goes well beyond just consolidating hospitals. And I know folks have heard me say this, really want to start a revolution in a positive way. And people have said to me, gosh, is this helping you with leverage? Does this help you compete with, take it, Penn, Temple? And I've said this to everybody, and I really mean it. We're not competing against Penn and Temple. We're competing against the lethargy of the old healthcare. We're competing against the fact that we haven't made more advances in quality and safety. We're competing against the lack of equality and health disparities. That's really what we're competing about. We are trying to create a new healthcare, and the reason that this model makes so much sense is because we're taking the talents and the assets of each community. So some of you have heard me say this. This is not a hub and spoke model, it's a hub and hub model. It's how can we get the best care out to the patients in this area. It takes all the best things that Jefferson, Abington, Aria, and others have to offer. So we couldn't be more excited about the spirit and commitment that I've experienced here at Aria from everybody that I've met. I've had a chance to meet with members of the medical staff. I think everyone is in this for the right reasons. I think it's important that you recognize that we appreciate the critical capabilities that Aria brings to the system. That's an excellent community health system, high quality care, patient safety, and really great clinical operations. And we're already learning in a lot of ways from the success that Aria has brought to this community. I am excited about this. This is just really one of the best days of my 2.5 years here. I've actually gone to some meetings at Aria where I've had to rest because the energy was beyond what I could handle. So that hasn't happened too often in my career, and I appreciate that from everybody that I've met with. So with that, let me turn it over to your leader and someone who will now take even an increased role in the New Jefferson as an Executive Vice President for Jefferson Health, Kate Kinsmore.
It's hard to even fathom not having enough energy because we would not be here today without the vision that Dr. Glasgow had, not only for Aria and what we are creating, but for healthcare and where it needs to move into the future. He is visionary, to say the least. He's got the energy to make it happen, and he has brought the right people together in order for that to occur. It is so heartwarming for me today to look around this room and see the many faces of those of you at Aria that I have just come to love over the last 6 years that I have been here, that I have worked with so closely, and as we have transitioned through this time period to where we are today. Again, I want to thank Bob Truitt and his leadership. He has been a stalwart, a mentor, and certainly someone at all times that I could lean on and help to guide us and direct us. And our board members, so many of them that are here today, John Midkiss, who has had a tenure back since the 1970s here in our organization and has devoted so much of his professional life, as well as Jay Blumenthal. Not only was Jay a board chair, but his father was as well. And I am sure he's looking down on us today and very proud of the work that you have carried on. I would be remiss not to thank also our physician leadership who have worked hand in glove with me through this entire process and helped guide our organization in a way that was collaborative and physician-led. Thank you so much for all that you have done, for the time that you have spent and the commitment that you have given, and certainly for my senior leadership team who has given me counsel and has worked with me countless hours to make sure that we have done the best for Aria. Also the staff members. There's so many of you here, and you're so important in every single thing you do. And I always say, Aria is not about the bricks and mortar, it's about you. It's about who you are, because you are the heart and soul of this organization. So thank you for coming and what you have done. As you know, that this has been a culmination of more than 2 years of intensive work of all of us together, and it's been a tremendous effort to help us reach this really very exciting moment. Aria has a very rich history that goes back over 113 years, and it was founded on the 4th of July in 1903. And it was founded, as many of you know, at the Frankfurt campus, and is now one of the 3 campuses that comprises Aria Health System. At that point in time, the desire was to create access to services for our patients in Northeast Philadelphia, Bucks County, and beyond. And the way to provide that was to erect buildings, which we did. But more than a century later, it's really not about buildings, but the people that are in them and the access to care that we provide to our patients every single day. We have such dedicated clinicians, nurses, and skilled individuals and ancillary personnel, as well as support people, who make sure our hospital is clean, our patients are fed, and that beyond anything, the patient is in the center, and it is about caring. We have put technology at their fingertips, and we have enabled them to engage with the patients and to ensure that we are serving the communities that we serve. Getting all of these things right is ensuring that the vision that Dr. Glasgow has of reimagining healthcare actually happens. And Aria truly wants to be part of those creative solutions that will improve care, the experience for the patient and for their families. And we are confident more than ever that now that we have come together and joined Abington as well as Jefferson, that the 3 of us are even more better together. We have great leadership with the chairs of Jefferson Health and our colleagues, and many of you that are here today that are the new part of our family, that will help us as we form a new enterprise to move forward into the future, to not only be better than everyone else, but to create our mark on the whole region and beyond. With the integration of the healthcare system, Thomas Jefferson University and Jefferson Health, this now spans more than 23,000 employees, 5,000 physicians and providers, as well as, and I'm very proud to say this, more than 6,000 nurses. We have a lot of experience, caring, and creative minds working together, making us better, even more better together. With the completion of our transaction, we have changed some leadership roles, and I am really happy to announce that Sandy Gomberg, who will now be the president of Aria Health. Sandy has tremendous experience. And she has shown what she can help us do since she has been here from 2013 as our Chief Operating Officer. I will continue to serve as the CEO of Aria, but as Dr. Glasgow previously mentioned, I will have an expanded role in the system as the Chief Integration Officer for Jefferson Health. And I am really proud to be able to work with my colleagues not only here at Abington, but certainly my new colleagues at Jefferson. And I have had several meetings already, and I know this is going to be an exciting time for all this, because there is a tremendous amount of momentum behind creating this new vision. I know that we have a lot of hard work ahead of us, and it is not necessarily easy to achieve the aims that we have set forth. We are in the process of reinventing healthcare, and it's hard when you're reinventing something that continuously changes, as we all know that does. But we are committed to serving the communities that we serve and to expand beyond them, not only into New Jersey, but with the vision that Dr. Glasgow has, I have no doubt that it will even be beyond. Our organizations already share many elements of culture, and we are extremely lucky for that, because most organizations that come together, that's where it fails. But we, as we set out on this process, did a great deal of work ensuring that our culture was consistent with the culture of Abington as well as most certainly Jefferson, and our new colleagues that will be coming into the system, Philadelphia University, as well as Kennedy Healthcare System. It still takes time and effort to nurture and grow all this, but we have a big head start over many other organizations that have come together and found that they have some sticky cultural differences that are hard or sometimes even impossible to resolve. I know that will not be the case for us because we have great people who share the vision of Dr. Glasgow, who are helping us reimagine healthcare and moving us into the future. It is now my great pleasure to introduce the chair of Jefferson Health, Richard Hebner, who will have a few words to say about our shared cultures.
I'm a little bit worried when he says this time we're serious. Thank you. I'm very honored to be with you all here today. I've been proud to have been a part of this innovative organization for more than 26 years, serving as chairman of the board for the last 2 years. Our success has as much to do with our decision to partner with like-minded organizations like Aria and Abington, and soon Philadelphia University and Kennedy Health System, so that together we better meet the healthcare needs of our city and of our region. The cultural connection between Jefferson and Abington and now Aria benefits patients because we're all focused on delivering the best care at the most efficient cost in the right setting and as close to the patients as possible. Under Dr. Glasgow's leadership and vision, there is now a new model for healthcare, one that supports and fosters a relationship between academic medical center and community hospitals throughout the area. The new vision is happening at the board level, where a governance model with equal representation from Jefferson, Abington, and now Aria has been established. It's happening at the patient care level with collaboration like Jefferson and Abington's work in our heart and vascular service line, and it's also happening here at Aria. Kate will be leading the integration efforts for all of the entities across the enterprise. Ron Coomer is leading the collaboration with colleagues across the enterprise to retain and expand and specialty care service delivery within the broader healthcare system. And Maria Sergio-Slade will be leading enterprise-wide integration communication efforts. One thing I'm particularly proud of is the fact that at Jefferson, our community hospitals are incredibly valued for what they do for patients. Our community hospitals are a true focal point for reaching deep into our neighborhoods to deliver care close to home where it's accessible and convenient. Combine that with a world-class academic medical center, and you've got a powerful formula to drive patient care and enhance patient experiences. We've accomplished a great deal over the past few years in particular, but the best is yet to come. Abington and Aria both deliver exceptional care to patients in their communities, and we are going from strength to strength and coming together. Thank you for your time and for your commitment to the future we're building together, and I'll now turn the meeting over to the Aria Health Board Chair, Mr. Robert Trudeau.
It's interesting when you stand here after 3 or 4 excellent speakers and you look at your notes in the script, you're saying you have 1 of 2 choices. Shut up and sit down or ad-lib a little bit. So I'll try the latter. Thank you, Rick. Let me begin, if I might, to, before we get into my notes and ad-lib comments, recognize our new leadership in the Aria Health Legacy Board that really is in effect right now. I would like to begin with our chairman, Ed Terzansky. I see Ed in the back. Ed, would you please be recognized? Ed has taken over as of Thursday at the end of our board meeting. Ed has been our chairman of the Governance and Human Resources Committee, among other things. Tremendous asset, not only Aria Health to the board, but also will be a tremendous addition to Thomas Jefferson University Board. Ed, congratulations and good luck. I would also like to mention, under Ed's leadership, we have a woman, I think about the comments that were made about a month ago regarding Hillary Clinton being the first time that a major nominee of a major party has been nominated for President of the United States. Well, we have our own. We have Trista Walker. Is Trista here? Trista, would you raise your hand and recognize? Trista will be our first vice chair in 113 years of Frankfurt and Aria. So, Trista, congratulations and good luck. You can clap. And third, Ed McKenna. Was Ed able to make it? If not, Ed has been our vice chairman of the Finance Committee. Ed will be the treasurer of the Legacy Board. And last but certainly not least is Ben Sanchez here. If not, okay, would somebody pretend that they're Ben and he will be our secretary. So, Mr. Chairman, Mr. Krasinski, Ben is here. Hey, Ben. Thanks for joining us. So, that I wanted to share with you that will be the new leadership taking over for Aria Health, and we are in great hands. I would like to begin by talking about, I know exactly what Rick spoke of regarding culture from experience and exposure. The cultural fit that takes place in an organization that enables a combination that looks good on paper to become a success in reality. I can remember one time in a previous life for a company in which I worked, you talked about cultural fit. We were together in a new acquisition dealing with different levels of people, and we were sitting in a room with French, Italian, German, and Americans. So as you think we have challenges that we face today between two likewise organizations, you have no idea what you can go through in putting a culture together of something like that. So, Rick, you're right on. We have commonality in our two organizations that will work perfectly, maybe not perfectly, but excellently going forward. I want to take a moment to thank my fellow Aria board members. I get into a position here where it's mutual admiration society, but for all intents and purposes, it's meant to be. If I could just ask our board of directors to raise their hand and be recognized. Hard work, smart work, strategic thinking, and really making it happen, particularly in addition to supporting Kate and her leadership team, but specifically on this together to second to none in my view of putting ourselves in such a wonderful position for the future. Dr. Klasko, I just want to again say to you, you're the man. We have been working on this project for over 2 years with Kate's leadership as the point person, and our board joined at the hip with Kate and her team to make this happen. It's a winner, and we will see wonderful things for our patients, for our community, and most importantly, for our employees, who I thank you for being here with us today, for all the time and effort and energy that you have placed, not only for us, but most importantly, for our patients. I want to thank Kate Kinslow. Kate and I have worked together for 5.5 years. It so happened that I was fortunate enough, I don't know whether Dr. Corcoran is here or not. If not, we were on the search committee for Kate back 5.5 years ago of about 7 candidates, very much like our process in the alignment with Thomas Jefferson. And Kate was, no doubt about it, going to be our choice, just like Thomas Jefferson was going to be our choice if they would have us. What a wonderful decision that was made. As we see today, outcomes is what it's all about. Not verbiage, not lip service, but actions. So Kate, job well done. I want to just comment further on one thing about Kate that's already been announced, that Kate has a very, very difficult choice that she has made and finalized with Dr. Klasko, and that is that she will be, as has been reported, the Executive Vice President and leader of the integration efforts for all of the entities in the Thomas Jefferson system. That is Herculean, and she will need every one of our help and part to make that happen. That is an ongoing process that will really lead us to the success, and I won't even say failure, of making it happen not only short term, but long term. So Kate, good luck. You'll do a wonderful job. I know that for a fact. And moving right along, I just feel the excitement here today when I look around the faces of Aria, the faces of Thomas Jefferson, even the Penn people that snuck in the back of everything. A couple of them are smiling also. But we do have one Penn student here. Well, she's great, so she's very upbeat and positive. Spreading. So anyway, I just want to tell you how much that's appreciated and needed. Enthusiasm is really what continues to drive the culture. There will be days, there will be times, situations where it's not a perfect world. But that's the world that we live in, and I would tell you the word human capital was used. That's what it's all about. Our physicians, you do a great and wonderful job for our patients. And the nurses, the boots on the ground, we would never be able to do it without you. And administration, technical people, janitors, the people that are serving the food, every day doing what is right for the patients and for Aria. And with that, I just want to tell you, I am pleased, our board is pleased, our CEO is pleased. You're seeing the positions that are taking place as a consequence of this partnership being put together. Great job, congratulations, and let's give it hell. It's my honor to present our COO, Larry Merlis.
Thank you, Bob. Good afternoon, everyone. Being a disruptive innovator at a time of unprecedented change requires not only vision, but a clear understanding of the greater value that we can develop together. But that also requires us to accept a degree of risk. But that risk is mitigated when the focus is on doing what is right for the people that we are privileged to serve, and also by people who are bold and forward-thinking. It was 1 year ago, on July 1st, when we met with the trustee, physician, and executive leaders of Aria, and Dr. Klasko and our team presented our vision. We knew how important that day would be because we knew how important Aria, as a true partner, would be to our future success. The questions and dialogues are all about what would be best for the communities and patients that Aria has so faithfully served for so many years. We knew then, and know even more now, that Bob and Kate were the type of leaders, and Aria the type of organization that shared the same values and culture that we have, and one we would love to partner with. And now we stand here today, together, at this very special day in the history of Aria and in the history of the New Jefferson, to bring that vision to life, to reimagine health, education, and discovery, to create unparalleled value, and to be the most trusted partner for our community. On behalf of all of us at Jefferson, I would like to express our sincere thanks and appreciation to all of you for making this day and our new partnership a reality. And with that, it is now time to have Steve and Bob and Kate and Rick officially sign the closing documents that signals the coming together of Aria and Jefferson. Steve?
You made it easy. We are now official, everybody. Now, Hey, I wanted to get you a gift, and what do you get the woman that has everything? And I couldn't believe this, but they mentioned to me that you do not have a bust of Thomas Copper, a very heavy copper bust of Thomas Jefferson on your desk. So you now do.
Worth getting married.
I misunderstood. I thought this was a new Jeffy Award. And the winner is Hunter Truitt.
So please, party. I want you to, there's a bunch of folks here from Aria, Abington, Jefferson. Just for those, I just see a whole bunch of folks. Our Executive Vice President for IS&T is here. Our head of our innovation pillar, Praveen Chopra, is the head of IS&T. Rose Ritz is here, the head of the innovation pillar. Mike Vergara is here, our chair of psychiatry. Bill Schwapp, Jefferson's chair of OBGYN. Robert Rosenwasser, chair of neurosurgery and the head of the Vicky and Jack Farber Institute of Neurosciences. I might be missing some other folks. Dean and Provost Tikachinsky. What are you doing in the back, Mark? That's not like you. Is right there. And we have Hugh Lavery, the Executive Vice President for Government Affairs. And if I missed anybody else. And John Icarius, the Chief of Staff and Executive Vice President is here. So thank you all for being here, and let's party a little bit, talk to each other, and let's go forward and make great babies together. Thank you.